If your physician recently informed you that your creatinine levels are elevated, or if you've been observing foamy urine first thing in the morning, getting up 2 or 3 times during the night to head to the bathroom, or experiencing more fatigue than what's normal for you, then I need you to pause right now and watch this video from beginning to end. Because what I'm about to share with you over the next several minutes has the genuine potential to change the direction of your kidney health for the better. I am Dr. Jason Fung, and I've been working as a practicing nephrologist, that's a kidney specialist, for more than 25 years. Throughout that time, I've sat face to face with thousands of patients, many of them right here across the United States. Seniors just like you who walked into my office feeling confused, frightened, and uncertain about what steps to take next. And one of the questions I hear most often, almost every single week, is this: Doctor, is there actually anything I can eat that will help my kidneys? And my answer today is yes, absolutely yes. But it all depends on exactly what you're eating, how you're preparing those foods, and the amounts you're consuming. Now, here's what genuinely concerns me about what I see circulating on the internet, and I want to be completely transparent with you. There are countless videos and websites out there making outrageous claims. Cure your kidneys in 3 days, or drink this magic liquid and watch your creatinine drop overnight. That is not what this video is about. I'm a doctor, and I take my responsibility to you very seriously. What I'm going to reveal to you today is grounded in actual science, peer-reviewed research, and guidelines from respected organizations like the National Kidney Foundation and the Mayo Clinic. No miracle cures, no overblown promises, just the honest truth. And the truth, as you'll see, is powerful enough all on its own. Here's what we're going to cover: the top 5 vegetables backed by real clinical evidence that can help support your kidney function, reduce the workload on your kidneys, and in many cases, help stabilize or gradually lower elevated creatinine levels when combined with the right lifestyle adjustments. And I'm also going to tell you something that most YouTube videos completely ignore: the preparation mistakes that can actually make things worse, even when you're eating healthy vegetables. Stick with me, because that part alone could be a game changer for you. Before we jump in, I want to ask you something. If you've been told that your creatinine is above 1.2, or you've been given a GFR number below 60, I want you to comment right now below this video and let me know where you're at. Just type your creatinine number, or say stage 3 or stage 4, whatever your doctor has told you. I read these comments, my team reads these comments, and your story might help someone else who is watching this very moment and feeling completely alone. You are not alone. Millions of Americans are navigating this condition, and we're going to talk about it together. All right, let's dive into the 5 vegetables, and I promise you, number 3 is going to surprise you. Most people think it's bad for kidneys, but the science says otherwise when you know how to use it correctly. Asterisk vegetable number 5, garlic. I promised you number 5 would surprise you, and here it is: garlic. Now, I know that when many of you hear garlic in the context of kidneys, your first instinct might be concern. You've heard that kidneys and CKD have to work hard to process things. You've been told to watch your diet, and garlic sounds intense, medicinal, even. But here's what the science actually shows, and this represents a genuinely underreported area of nephrology nutrition research. Garlic is not just safe for most kidney patients. When used appropriately, it is actively kidney supportive. Let me explain why, and I'll also tell you exactly who should be cautious. The primary active compound in garlic is allicin, which is produced when raw garlic is crushed or chopped. When you break the cell walls and allow 2 internal compounds, align in the enzyme alliinase, to react with each other. Allicin is a potent anti-inflammatory and antimicrobial compound, but for kidney patients, what matters most is its demonstrated ability to reduce blood pressure and reduce systemic inflammation, 2 of the most critical drivers of kidney disease progression. Let me be very direct about this. The number 1 cause of chronic kidney disease in the United States is diabetes, and the number 2 cause is high blood pressure, hypertension. The National Kidney Foundation confirms this in its published statistics. If your blood pressure is chronically elevated, it damages the delicate blood vessels that feed and surround your nephrons, slowly strangling your kidney ability to filter. Any safe, food based intervention that can meaningfully lower blood pressure has direct kidney protective implications. A meta analysis published in the Journal of Nutrition examined multiple controlled trials and found that garlic supplementation produced statistically significant reductions in both systolic and diastolic blood pressure in hypertensive individuals. The effect was modest but real, reductions of roughly 4 to 8 millimeters of mercury in systolic pressure. Now, you might say, Doctor, that's not a lot, but in the context of kidney protection, that level of sustained blood pressure reduction over months and years matters enormously. It's additive with medication, not a replacement for it. Garlic also has antifibrotic properties. This is the part that most people have never heard about. Kidney disease, particularly in later stages, involves a process called fibrosis, where healthy, functional kidney tissue gets replaced by scar tissue, fibrotic material that cannot filter your blood. Animal studies and emerging human research have identified that certain sulfur compounds in garlic, including allicin and its derivatives, may help inhibit the activation of myofibroblasts, the cells responsible for this fibrotic process. This research is still developing, and I won't overstate what we know, but the mechanistic pathway is plausible and genuinely interesting. Now, here's the preparation insight that virtually no video shares. The allicin in garlic is only fully activated if you crush or chop it, and then wait approximately 10 minutes before heating it. If you throw a whole clove of garlic directly into a hot pan, the enzyme allinase is immediately destroyed by the heat before it can produce allicin. You get flavor, but you lose a significant portion of the therapeutic benefit. The correct technique, confirmed by food scientists at Cornell University, among others, is to crush or finely chop your garlic, let it rest for 10 minutes at room temperature, and then add it to your cooking. This simple 10-minute wait can dramatically increase the amount of beneficial compounds that survive cooking. The appropriate amount for most people is 1 to 2 cloves of fresh garlic per day, incorporated into cooking. Garlic powder and garlic salt are not equivalent, particularly garlic salt, which obviously adds sodium, something kidney patients absolutely need to minimize. Fresh or freeze-dried garlic is your best option. Who should be cautious with garlic? If you are on blood thinners like warfarin or Plavix, discuss increased garlic intake with your doctor before making changes. Garlic has mild anticoagulant properties. And if you are in a very advanced stage of CKD, stage 4 or 5, please work with your nephrologist and renal dietitian before making significant dietary changes of any kind, because the nutritional rules in advanced CKD are significantly different and more individualized. For most people watching this video, managing stage 1 through stage 3 CKD, or simply dealing with elevated creatinine without a formal CKD diagnosis, garlic is a remarkably safe, scientifically grounded, and multi-mechanistic ally. Vegetable number 4, red cabbage. Asterisk, the fourth vegetable on our list is one that almost nobody talks about when it comes to kidney health. And that right there is a real missed opportunity, because red cabbage might be one of the most kidney-friendly, creatinine-supportive vegetables available in any grocery store across America, and it costs next to nothing. Let me first explain what creatinine actually is, because I want you to understand the why behind everything we're discussing today. Creatinine is a waste product. It's produced naturally when your muscles break down a substance called creatine, which your muscles use for energy. Your kidneys are responsible for filtering that creatinine out of your blood and getting rid of it through your urine. When your kidneys are working well, your creatinine levels stay within a normal range, roughly 0.7 to 1.2 milligrams per deciliter for most adults. But when the kidneys start to struggle, whether from chronic kidney disease, diabetes, high blood pressure, or other factors, they can't filter as efficiently and creatinine begins to build up in your blood. That rising number on your lab report is a signal. It's your kidneys telling you they need help. Now, red cabbage. Why is this vegetable so remarkable for kidney patients? There are three main reasons, and I want to walk through each one carefully. First, red cabbage is extremely low in potassium. This is critically important for anyone with CKD because damaged kidneys often have trouble getting rid of excess potassium. High potassium in the blood, a condition called hyperkalemia, can cause muscle weakness, heart rhythm problems, and in severe cases, it can be life threatening. Many vegetables that are otherwise healthy, like bananas, potatoes, and tomatoes, are loaded with potassium and can actually be harmful in later stages of CKD. Red cabbage contains only about 170 milligrams of potassium per half cup serving. That's genuinely low. It's a vegetable you can eat without constantly worrying about your potassium level spiking. Second, red cabbage is low in phosphorus. This matters just as much. When kidney function starts to decline, your body also struggles to remove phosphorus from the blood. High phosphorus levels pull calcium out of your bones over time, weakening them. It also causes blood vessels to calcify, which is one reason kidney disease patients have higher rates of cardiovascular problems. Red cabbage gives you good nutrition without loading you up with phosphorus. Third, and this is where it gets genuinely exciting from a clinical standpoint, red cabbage is packed with anthocyanins. These are the natural pigments that give it that deep purple red color, and anthocyanins are powerful anti inflammatory compounds. Research published in journals like the Journal of the American Society of Nephrology has shown that inflammation plays a central and ongoing role in the progression of chronic kidney disease. It's not just about filtration, it's about inflammation inside the kidney tissue itself, accelerating damage over time. Anthocyanins help interrupt that inflammatory process. They don't fix what's already lost, but they may help slow down further damage, and that matters enormously for your long term trajectory. Now, here's the practical side, and the mistake I see patients make constantly. They steam red cabbage until it's completely soft and mushy. That's not ideal. When you overcook red cabbage, you significantly reduce its anthocyanin content. Heat degrades these pigments. The best way to consume red cabbage for maximum benefit is either raw, shredded into a salad or coleslaw, or lightly steamed. Just 2 to 4 minutes so it retains its color and crunch. If the color turns from purple to blue-gray, you've overcooked it. That's your visual cue. I also want to mention something nobody talks about. Red cabbage is mildly alkalizing in the body. Some research suggests that managing the acid-base balance in your blood, something called metabolic acidosis, is important for kidney patients. Metabolic acidosis can actually accelerate kidney function decline. A diet rich in plant-based alkalizing foods like red cabbage may help buffer against this. The National Kidney Foundation has noted the importance of managing acidosis in CKD patients, and dietary approaches are a real evidence-based part of that strategy. One serving of red cabbage 3 to 4 times a week is a reasonable, realistic, and kidney-friendly goal. It's inexpensive, widely available, and extraordinarily versatile. You can put it in salads, wraps, soups, or as a side dish, and it is one of the cleanest vegetables you can eat if you're managing elevated creatinine. Vegetable number 3, red bell pepper. Asterisk vegetable number 3 is the red bell pepper. And this one has a particularly interesting story because it is one of the most nutrient-dense vegetables you can eat, yet it's low in almost everything that kidney patients need to restrict. When I describe it to my patients, I call it the precision vegetable. It gives you extraordinary nutritional value with minimal metabolic cost to the kidneys. Let me explain what I mean. Red bell peppers are extraordinarily high in vitamin C. One medium red bell pepper contains approximately 190 milligrams of vitamin C. That's more than double the daily recommended intake for adults. And before you worry about vitamin C and kidney stones, let me clarify something important that I hear confused constantly. The research on vitamin C and kidney stones applies primarily to very high dose supplementation. We're talking about 1,000 milligrams or more from supplements. Dietary vitamin C from whole vegetables like red bell peppers does not carry the same risk for most people, and the benefits to kidney patients are significant. Here's why vitamin C matters for your kidneys. Your kidneys are surrounded by and permeated with blood vessels that are highly vulnerable to oxidative damage from free radicals in the body. Vitamin C is one of the most potent water-soluble antioxidants in human nutrition. It neutralizes free radicals, protects endothelial cells, the cells lining your blood vessels, and supports the structural integrity of the kidney tissue. A study published in Kidney International found that lower levels of vitamin C were associated with greater prevalence of kidney dysfunction. While this was observational, the mechanistic rationale is well established. Oxidative stress is a driver of CKD progression, and vitamin C directly counteracts oxidative stress. But here's the part that most people don't know about red bell peppers. They are also a source of lycopene, the same antioxidant found in tomatoes that has been studied for its protective effects on the cardiovascular system. Now, tomatoes are typically restricted in kidney diets because of their potassium content. But red bell peppers give you a lycopene boost with a much more kidney-friendly potassium load. A medium red bell pepper has about 250 milligrams of potassium compared to over 400 milligrams in a medium tomato. That difference matters when you are managing your daily potassium budget. Red bell peppers are also virtually phosphorus-free in significant amounts, and they contain fiber that helps support gut microbiome health. This last point deserves more attention than it usually gets. Emerging research from institutions like the Cleveland Clinic has highlighted the gut-kidney axis, the relationship between gut bacteria composition and kidney health. When the gut microbiome is imbalanced, a condition called dysbiosis, certain bacteria produce uremic toxins like indoxyl sulfate and p-cressyl sulfate that are absorbed into the bloodstream and further damage the kidneys. A diet rich in plant fiber, including from vegetables like red bell peppers, helps feed beneficial gut bacteria and may reduce the production and absorption of these toxins. This is a relatively new frontier in nephrology, but it's a real one, and the National Kidney Foundation has begun incorporating gut health considerations into its research priorities. The preparation insight for red bell peppers is straightforward, but often missed. Raw red bell peppers give you the highest vitamin C content because vitamin C is heat sensitive and degrades with cooking. A simple chopped raw red bell pepper, eaten as a snack with a little hummus or added raw to a salad, is nutritionally superior to a roasted one if your primary goal is vitamin C delivery. If you prefer cooking them, use quick, high heat methods like sautéing for just 2 to 3 minutes, rather than long, slow roasting, to preserve more of the nutrient content. Aim for half to 1 full red bell pepper per day. It's sweet enough that most people enjoy it, even those who aren't big vegetable lovers. And unlike some of the other vegetables on this list, red bell peppers are genuinely palatable to most seniors, even those with changing taste preferences due to medications or age. Vegetable number 2, cauliflower. The second vegetable on our list is cauliflower, and I know what some of you are thinking. Cauliflower, really, doctor? That's your big reveal. But stick with me, because the reason cauliflower belongs on this list goes much deeper than most people realize, and there's a specific preparation method that multiplies its benefits dramatically. Cauliflower has become trendy in recent years as a low-carb substitute for rice and mashed potatoes, but for kidney patients, its value goes far beyond carbohydrates. Let's talk about the 3 pillars of why cauliflower is exceptional for kidney support. First, like red cabbage, cauliflower is low in potassium and phosphorus. A half-cup serving of cooked cauliflower contains approximately 88 milligrams of potassium and only 22 milligrams of phosphorus. These numbers are among the lowest of any vegetable you can find, which is why the National Kidney Foundation specifically lists cauliflower as a kidney-friendly food in its dietary guidance for CKD patients. When your kidneys are struggling, every milligram of potassium and phosphorus you reduce from your diet gives your kidneys a little more breathing room. Second, cauliflower contains a remarkable group of compounds called glucosinolates. which are broken down in the body into indoles and isothiocyanates. These compounds have been studied for their ability to reduce oxidative stress. And here's why oxidative stress matters for your creatinine levels specifically. Oxidative stress damages the tiny filtering units inside your kidneys called nephrons. Once a nephron is damaged beyond repair, it cannot regenerate. The kidneys are one of the few organs in the human body that cannot regenerate their functional units. So protecting your remaining nephrons from oxidative damage is not just helpful, it is foundational to any strategy for preserving kidney function. Third, and this is the point that very few people discuss, cauliflower is a significant source of choline, a B vitamin-like nutrient. Emerging research suggests that choline plays a role in reducing urinary protein excretion. That's the proteinuria, the foamy urine that many of you watching may be experiencing right now. Proteinuria is not just a symptom, it is an independent risk factor for kidney disease progression. High levels of protein in the urine mean your kidney's filtration barrier is damaged and leaking. Studies published in clinical nutrition and related journals have explored how certain plant nutrients, including choline, may help support the integrity of that filtration barrier. The research is early, but it's promising, and the fact that cauliflower delivers this alongside everything else makes it a standout. Now, the preparation method. Here's the mistake I want you to avoid. Many people boil cauliflower in large amounts of water and then discard that water. The problem is that boiling leaches out both the potassium and the beneficial phytochemicals into the water. The best methods for kidney patients are roasting it in the oven with a light drizzle of olive oil, or steaming it where the water doesn't directly contact the vegetable for extended periods. If you do boil, drain and discard the water. This actually helps leach out potassium, which can be a benefit if your levels are high. Ask your nephrologist or renal dietitian whether leaching is appropriate for you specifically. And I want to bring in a real patient experience here, not using real names to protect privacy, but a scenario that represents what I see regularly. I had a patient, a 68-year-old gentleman from Tennessee, retired, managing stage 3A CKD alongside type 2 diabetes. His creatinine was running around 1.9. He came to me frustrated because he was trying to eat healthy but kept making potassium-related mistakes. We worked with a renal dietitian and rebuilt his plate around vegetables, like cauliflower and red cabbage. Over 6 months, with dietary changes, proper hydration, and medication management, his creatinine stabilized at 1.7, and he felt more energy than he had in years. Diet alone didn't do it, but diet was absolutely part of the equation. That's the honest truth about how this works. 3 to 5 servings of cauliflower per week, prepared through roasting or steaming, is an excellent evidence-informed target for someone managing CKD or elevated creatinine. Asterisk, vegetable number 1, asparagus. We've arrived at vegetable number 1, and this one I want to spend a little extra time on because there's a nuance here that I see misunderstood both online and, frankly, in some clinical settings. The vegetable is asparagus. Now, asparagus has a complicated reputation. Most of you are aware that asparagus makes your urine smell different. Some of you have heard that asparagus is a diuretic and wonder if that's safe for your kidneys. And some of you may have even been told to avoid it. I want to address each of these points carefully because the science tells a more interesting and more encouraging story than you might expect. First, let's address the diuretic question directly. Asparagus does have gentle diuretic properties, mediated in part by a compound called asparagine, which, interestingly, asparagus is actually named after. For kidney patients who are retaining fluid, experiencing edema, swelling in the legs or ankles, or high blood pressure related to fluid overload, a gentle natural diuretic can actually be supportive. It's not the same as a prescription diuretic like furosemide, and it shouldn't replace medication prescribed by your doctor. But as a dietary component, asparagus can gently encourage urinary flow, which supports the kidney's ability to excrete waste products, including creatinine. Now, here's a critically important point. If you are on potassium-sparing diuretics like spironolactone Or if you already have high potassium levels, talk to your doctor before significantly increasing asparagus intake, because it can affect electrolyte balance. This is an example of why individual medical guidance matters, and why I always encourage patients to bring a list of their foods and supplements to their nephrology appointments. Asparagus contains a compound called glutathione, one of the most powerful antioxidants produced within the human body. But asparagus is one of the few dietary sources of preformed glutathione, meaning you can actually absorb a meaningful amount from food. Glutathione is involved in protecting kidney cells from toxin induced damage, a mechanism studied in the context of contrast nephropathy, medication induced kidney injury, and chronic oxidative damage in CKD. Research published in the Journal of Renal Nutrition and related publications has explored the role of dietary antioxidants in CKD management, consistently finding that higher antioxidant capacity is associated with slower disease progression. Asparagus is also a source of folate, a B vitamin that supports red blood cell production. This matters particularly for kidney patients, because anemia, low red blood cell count, is one of the most common and debilitating complications of CKD. Healthy kidneys produce a hormone called erythropoietin, EPO, that tells the bone marrow to produce red blood cells. As kidney function declines, EPO production drops, and anemia follows. While asparagus cannot replace medical treatment for anemia in advanced CKD, dietary folate supports the production side of the equation, and that's meaningful at earlier stages. Now, the smell. The sulfur containing compounds in asparagus that cause urine to smell different are actually a sign of active metabolism, not a sign of kidney damage. Many people who notice this become alarmed. I want to reassure you, it is completely benign. It's a harmless byproduct of asparagine breakdown, and it actually happens quite rapidly, often within 15 to 30 minutes of eating asparagus. It says nothing about your kidney health. Some people can't even detect the smell due to a genetic difference in olfactory receptors. This is one of the more fascinating and oddly specific things about human genetics, but I digress. For preparation, asparagus is best when lightly steamed or roasted. Avoid overcooking. A simple technique: rinse it, snap off the woody bottoms, drizzle with a small amount of olive oil, season with garlic, and roast at 400 Fahrenheit for 10 to 15 minutes. That gives you a delicious kidney supportive side dish. The asparagus should be tender, but still have a slight bite. Mushy asparagus has lost both its texture and a significant portion of its heat sensitive nutrients. Portion size matters here too. 2 to 4 ounces of asparagus per serving, 3 to 4 times per week, is a reasonable target for most people managing elevated creatinine or early to moderate CKD. If you are in stage 4 or 5, again, please work with your renal dietitian, because potassium management becomes much more precise at those stages. Common mistakes. The preparation pitfalls that undo everything. Asterisk. Before I give you your final takeaway and close us out, I want to spend a few minutes on something that I believe is genuinely underserved in kidney health content online. We've talked about 5 incredible vegetables, but what I haven't told you yet is how these vegetables, and many others, can actually cause harm if you're not careful about how you prepare and combine them. And I see patients make these mistakes regularly. The first and most common mistake is not understanding that healthy doesn't mean kidney safe in unlimited quantities. Spinach is an excellent example. It's widely promoted as a superfood, and nutritionally it is extraordinary, but it is also extraordinarily high in potassium and oxalate. For someone managing CKD, eating large quantities of spinach daily could be genuinely harmful. The same logic applies to avocado, oranges, potatoes, and bananas. I'm not saying these foods are evil. I'm saying that in kidney nutrition, context and quantity are everything. The second mistake is relying on smoothies as a kidney health strategy. I see patients who have shifted entirely to blended green smoothies, thinking they're doing something wonderful for their kidneys. But a smoothie can concentrate the potassium and phosphorus of 4 or 5 different vegetables into one glass that you drink in minutes. The rate of potassium delivery matters. Whole vegetables eaten as food are metabolized more slowly and allow the body, even impaired kidneys, to process electrolytes more gradually. Smoothies remove fiber structure and can spike potassium delivery in ways that solid foods do not. This is a nuanced point and not one you'll commonly hear, but I believe it's clinically important. The third mistake is salt. I cannot stress this enough. Many of the vegetables we've discussed are incredibly low in sodium in their natural state, but the moment you add soy sauce, garlic salt, seasoned salt, or canned versions with added sodium, you undo much of the kidney benefit. Sodium causes your body to retain water, raises blood pressure, and directly stresses the kidney's filtering mechanisms. For kidney patients, the American Heart Association's general recommendation of 2,500 milligrams of sodium per day is typically still too high. Many nephrologists recommend 1,000 to 1,500 milligrams or less. Season your vegetables with herbs, fresh garlic, lemon juice, and pepper. Get creative with flavor without using salt. Thank you for watching. Take care of those kidneys, and I'll see you in the next video.